Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings, an awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Neck's in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. We do this on Wednesdays. We talk injuries, mainly NFL injuries, but a lot of baseball, obviously, this year as well, with one of the experts from OrthoCincy. What we love about OrthoCincy is they have specialists and locations all over the tri-state, and they also offer walk-in orthopedic urgent care during the week, 9 a.m. to 9 p.m., Saturdays 9 a.m. to 1 p.m. in Edgewood and Anderson. Learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. Amelia Wiggins from OrthoCincy is with us. It feels like the Bengals dodged a bullet when it comes to Sam Hubbard taking off on a cart Sunday. Didn't go through yesterday's practice in pads. No practice today. They're calling what he has a knee injury. They insist they don't believe it's serious. Let's run through the gamut of possibilities here. What sort of things are being considered?
So a knee injury, a sprain, we could be talking about a sprain of an MCL, the ligament on the inside of the knee. A lot of times when guys get tangled up, that can get stretched. A grade 1 MCL sprain, you're looking at 4 to 6 weeks at the most. So that would be one option. A patella subluxation or dislocation, sometimes the kneecap shifts in the groove there, and that can cause some pain in the front of the knee, and certainly that would cause an athlete to stop. And that could, very minor, you can cause a subluxation, and the patient would have some discomfort, but that would resolve quickly. Hopefully that's what's happening. He could also have a bone bruise. The same way you bruise a muscle or anything else in your body, you can actually bruise your bone, which can cause pain, can cause swelling, but it doesn't require surgery. So that could be something that's going on as well, just from an impact.
We hear all the time about how they're going to perform an MRI, and I've never had an MRI done, yet it's become kind of part of our basic everyday conversation, and yet so many of us really don't know what an MRI is, how it works, how it's applied. So how is it used, especially in a case like this, where you're trying to figure out exactly what the issue might be?
Yeah, MRIs are so helpful. We use them all the time to assist with our diagnosis. We do a physical exam. We have great physical exam skills. We generally know what is going on, but the MRI adds a little extra information. So something like an ACL, that's generally easy for me to diagnose with my physical exam. But that bone bruise, that's not something that I can see on exam. There's not a test for that. It's just a clinical suspicion. And so the MRI shows us that closer look. What's happening with the meniscus, what's happening with the cartilage, what's happening. There's fat pads and synovium in the knee, and those can get aggravated and cause inflammation. The MRI gives you that closer look that an X-ray and a physical exam don't give. For those of us in the real world, we would probably wait 4 to 6 weeks to see, did the pain get better on its own? And if it doesn't, then we get an MRI. That's when you or I would get one. But for a professional athlete, you got to move quick, because we don't have 4 to 6 weeks to see if they're going to get better. And there are treatments that they can do. If an MRI shows a low-grade MCL sprain, they can do a PRP injection to improve the healing on that. If it shows the bone bruise, he can start getting back into light activity as his symptoms allow. If it shows a meniscus contusion, we can progress him through that a little bit faster than, some other scenarios. So the MRI is so helpful for our professional athletes, because it really gives us a baseline, and then we can talk to them more about their prognosis, what really are the risks if we move too quickly or too slowly on a specific injury. You mentioned ACL injuries, and that's what one of the newer Bengals dealt with in college, Erick All. And the good news was cleared to return to the practice field this week. And so he suffered this injury back in October, back on the field in late July. Does that fit within the typical timeline for an injury like this? Absolutely. I tell my athletes 9 months to a year, and professional versus high school, it's all the same. We can't rush biology, and the biology takes 9 months to a year to heal an ACL reconstruction. His graft is now in its final stages of healing, so now he's ready to start playing, and he's been doing the functional rehab all along. So his muscles have been ready for a while. It's just a matter of letting that graft mature, and usually 9 months to a year, that's when we see that happening. So now it's appropriate for him to get back out there, start taking some hits, and this is the perfect time for him to get back because he can go a little bit lighter during this preseason, lighter for professional athlete, of course, but lighter. And then as they progress the intensity of their practice, he'll get more confident in his knee as well. I would much rather him come back now, go through the preseason, the training, and then be ready to go 100% day one than to start practice at game one. Because you can't just go in at 100%. He's going to ramp up.
Right. So when an athlete is cleared, are there? I mean, obviously you're watching him a little bit more closely than an athlete who's not dealt with any injury. But are there extra precautions that they may be taking with him as opposed to other guys who have been healthy all along?
Yeah, absolutely. Like his first few weeks, even up to a month back at practice, which he's been doing probably for a few months, is 50% speed, 50%, with his agilities, he'll go 50% power. Then as that's feeling good, he's feeling confident. Then they'll add a little bit more intensity, more duration to his workouts. He would still be non-contact until about that 9th or 10th month point. And then even when he starts contact with drills, he'll start light contact. They'll tell his teammates, don't hit him as hard as you hit somebody first time out. Let him get his feet under him, let him get his confidence back. Mentally recovering from an ACL injury and an injury in general is often a part of it too. So they've got to build the confidence back that they can take a hit and they can give a hit. And so gradually over the next few months, he'll take harder hits, he'll progress back to full strength.
Dr. Amelia Wiggins from OrthoCincy is with us. I want to ask you about two Reds dealing with a similar injury that I don't think I had ever heard of. Brent Suter, the lefty pitcher, went on the injured list a week and a half ago with what they call a partial tear of the left teres major muscle. And then the Reds had a catcher, Austin Wynns. He was placed on the injured list after this weekend with a partial tear of the right teres major muscle. I don't know that I've ever heard of the teres major muscle. What is it?
I know. Yes, it's not one commonly talked about. I was excited to see it's on here. But you've heard of the latissimus dorsi. You've heard of the lats.
Right.
You go and you do a lats day at the gym. Okay. The teres major runs right along the lat. The lat starts at the spine and goes to the humerus, right where the inside of your arm. The teres major goes from the scapula to that same insertion spot on the humerus. So if people tear their lat, it would feel the same. And I think one of the guys said that he felt tightness in his lat.
Right.
Well, that teres major is running right along with it. So just like your lat adducts, it brings your arm across your body and it internally rotates, which is obviously very important for a pitcher's biomechanics. The pitchers and throwers are using their teres major as well with their lats to get that job done.
Are we talking about an injury here that usually requires surgery?
No, not typically. With a teres major injury, those are typically treated conservatively, especially if it's a tear within the muscle. It's time, it's rest, anti-inflammatories, and then a progression back to throwing. A lat tear, now they often will happen together. You'll get a latissimus dorsi injury, and the teres major can be injured as well. If the latissimus dorsi pulled off the bone, same way you could pull your pec major off your bone and have a pec tear, that is one that would require surgery. But typically with the teres major tears, those are usually more muscular, and there's no surgery indicated for that.
All right. Something I never heard of. Now I know a lot more. Always awesome to have you with us. Thank you so much.
Awesome. Thank you. Always good to talk.
It is awesome to have Dr. Amelia Wiggins with us from OrthoCincy. I say this every week. The great thing about the people at OrthoCincy is they have specialists and locations across the tri-state. Offers walk-in orthopedic urgent care during the week, 9A to 9P, Saturdays 9A to 1P in Edgewood and Anderson. Better than going to an ER, cheaper than going to an ER, more convenient than going to an ER whenever you have an urgent orthopedic injury. OrthoCincy.com, OrthoCincy.com. Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.